Alright, hi, my name is Miranda. I'm going to be taking care of you today. So really quick, I'm going to perform hand hygiene and I'm going to go close this curtain for you, or this door. Alright, can you give me your wristband and tell me your name and date of birth, please?
Miranda Mosley, February 20, 2002.
Okay, thank you. And if you had a medical ID number, I'd also read that out loud. Alright, everything that we do and say in here will be confidential, and you have the right to refuse any of the activities that we do. Is that okay?
That's okay.
Okay. Can you tell me your name again, please?
Trinity.
Okay, can you tell me where you are right now?
Your house.
Okay, and can you tell me what day of the week it is and what year it is?
Wednesday, 2021.
Okay, perfect. Patient is alert, awake, and oriented, and demonstrates good speech and communication skills for age and can follow verbal commands. So we'll get started with the physical assessment really quick. Alright, so first thing I'm going to do is I'm going to check your pupil size, okay? So if you can just look straight ahead for me really quick. Alright, so that will be about a 4 millimeter in the left and right eye bilaterally. Okay, so I'm going to test your response to light. And to do that, I'm going to flip the lights off really quick if that's okay with you. Alright, look straight ahead for me. Alright, patient's pupils are equal and round and responsive to light bilaterally in both eyes. Now we're going to test your accommodation. So if you can stare at that little bird right there. And then when I tell you to, you're just going to look at the top of this pen and I'm going to bring it towards your eyes, okay? Alright, go ahead and stare at that for me. Alright, can you go ahead and stare at the pen? Good. Alright, pupils constrict bilaterally upon bringing the pen to our eye and dilate. Alright, and now we're going to do the Snellen chart really quick. So I'm going to get my patient to stand up and walk over to our Snellen chart. Alright, can you go ahead and cover your right eye for me, please? And you wear corrective glasses, correct? Okay, can you go ahead and read down?
TZ.
Good.
PTOC.
Good.
ZLPED.
Good.
ETODCF.
Good.
DPC. ZLFT. CFD. TEOPL.
Good.
LDC. ZOTEP.
Good.
PFCDTZLE.
Good. Alright, can you go ahead and cover your left eye for me?
Okay. TZ, PTOC, ZLPED, ETODCF, DPCZLFT, CFDTEOPL, LDCZOTEP, PFCDTZLE.
Good. Alright, and can you read with both eyes?
TZ, PTOC, OC, ZLPED, ETODCF, DPCZLFT, CFDTEOPL, LDCZOTEP, PFCDTZLE.
Good. Alright, so patient demonstrates, you can go ahead and take a seat. Patient demonstrates 2016 in right and left eye, and both eyes 2016 upon reading. Also, just to demonstrate, our Snellen chart is not up to size, so we had to make accommodations for this. Okay. I bet you know the whole alphabet by now. All right, so we're gonna go ahead and begin with the ears next. So can I get you to turn to your right side really quick? All right, so right ear is symmetric and aligned. The position is good bilaterally with the left ear, and they are aligned with the outer canthus of the eye. And on her right ear, there's no lesions, no redness, no bumps. She does have an ear piercing in the lower lobe of her right ear, and her skin tone matches her ear color. All right, and can I get you to turn to the other side, please? All right, so on the left ear, it is aligned with the outer canthus of the eye. The positioning is symmetrical, and the color matches skin tone, no redness, no swelling, no lesions, and there is also a piercing on the lower lobe of her ear. Okay, good. You can go ahead and face forward. All right. Now we're going to get started on your nose. So for this, can I get you to pull down your mask? You can put it up over your mouth, just your nose. Okay. All right. So nose is symmetrical and aligned. And skin characteristics, she has a small piercing on the left bottom side of her nose. No other unusual markings or distinguishing characteristics. Now I'm going to observe for turbinates in her nose, so if you can just look up. Good, okay. Turbinates present in both nares, and the septum is aligned. Okay. Next, we're gonna get started on the mouth, so I'll have you pull down your mask all the way. Okay. Can you go ahead and just open your mouth for me? Good. Okay, so teeth, no caries observed, and tongue looks moist and pink. Okay, can I get you to stick out your tongue and say ah? Good. Uvula rises upon phonation. Okay, can I get you to lift up your tongue? Good. For the mouth is good. All right, you can put it back down. And can you open your mouth? All right. Palate of the mouth is moist and pink. Buccal mucosa has no lesions, also moist and pink. Tonsils are a grade 1, they're still in. And the gums are pink and moist. Okay, and today would you like us to test your gag reflex? Okay. Patient defers gag reflex, but in order to do that, we would take a tongue blade and press down on her tongue and push it towards the back of her throat until it elicited a gag reflex. Okay, so now we're going to look at the neck. So neck is symmetrical. No discoloration or anything, no distinguishing marks. Okay, palpating for lumps, I do not feel any, so symmetry and lumps are good. All right, now I'm going to take my pen light and check for pulsations. All right, no pulsations visible on the neck. Now I'm going to palpate for your carotid pulse. Is that okay? All right. All right, grade for carotid pulses is 2+, strong and equal bilaterally. All right, I'm going to take my stethoscope, if that's okay, and I'm going to listen for carotid breaths, okay? So if you can just do me a favor and hold your breath when I tell you to, okay? And we're going to listen with the bell of the stethoscope. All right, take a deep breath in. Good. And let out. All right, and deep breath in. All right, no brute sounds present. So everything looks good. All right, now we're gonna move on to the posterior chest. So if I can get you to turn to your left. Perfect, thank you. All right, I'm going to, would you like to remove your shirt or do you want to just pull it up?
You just pull it.
Okay, all right, we're gonna pull up her shirt really quick. All right, now we're gonna inspect for skin characteristics. So she does have a small tattoo down her spine, approximately 4 inches long. Now we're going to also look, she has a birthmark on her side that is about 1 inch wide maybe and 3 inches in length. No other distinguishing marks or characteristics. Stretch marks are present on the bottom of the back. All right, I'm going to touch your back really quick and see if you have any tenderness, okay? So I'm gonna palpate for tenderness and just let me know if you have any, okay? All right, any tenderness?
No.
Okay, no tenderness present in the posterior chest. All right, and next I'm going to oscillate your chest, okay? So I'm gonna listen to your breath sounds, okay? So when my stethoscope touches your back, you're just gonna take a big breath in and out for me, okay? I'm gonna do this a couple of times. All right, go ahead. And just one more for me, please. All right, good. Breath sounds are present and equal. Oh, 1 second, can you turn back to your left hand side for me? All right, and last thing we're gonna do on the posterior chest is we're going to percuss for CBA tenderness. But yes, breath sounds were equal and clear, no abnormal sounds or anything. All right, so just let me know if you feel any tenderness, okay? Any tenderness? Okay, you can go ahead and turn back now. No CBA tenderness present bilaterally. And now we're gonna inspect the anterior chest, okay? So again, is it okay if I just pull up your shirt? Okay. Awesome, thank you. All right, so no distinguishing characteristics, no discoloration, stretch marks are present on the lower half of the abdomen. Okay, and we're also gonna look for rise and fall of her chest. So we can see that it is symmetric and unlabored, no heavy breathing present, and I will now count for her respirations for a full minute. All right, we're at 8 for the 30-second mark. All right, good. Approximately 17 on the respiratory rate. So we found that it's symmetrical, unlabored, counted your respiratory rate. So we are going to inspect the rest. So no other markings. I'm going to oscillate for your breath sounds really quick, okay?
Okay.
So if you would do the same that we did on the back, and I'm listening with the diaphragm. We're just gonna take, and I'm gonna start at the apex above the lungs. So we're gonna start way up here. All right, can you take a breath in? All right, same here. All right, go ahead. And here. All right, and here. Again. Again. And one more. Good. Breath sounds are clear, unlabored, no coughs or anything like that. All right. So now we are going to move on. We're going to move on to the heart. So I'm going to listen to your heart sounds really quick, okay? Yeah. All right, so first I'm going to listen with the diaphragm and all 4 valves. We're going to start with the aortic. So equal heart sounds present in the second right intercostal space. All right, and then on the second left intercostal space, we're listening for the pulmonic valve. And heart sounds are also present and loud. So now we're going to listen on the tricuspid. I'm going to lift your valve just a little bit if that's okay. Alright, so tricuspid sounds are noted and present and strong. Alright, and then we're going to listen to the mitral. I'm going to have to put it under your bra just a little bit, I'm sorry.
Okay.
Alright, and mitral valve sounds are present and strong. Alright, now we're going to listen for any high-pitched sounds like murmurs or anything. Alright, no murmurs present in the mitral valve. No murmurs present in the tricuspid. No murmurs present there, and the pulmonic, and no murmurs present in the aortic. Lastly, we're going to auscultate and then palpate for the apical pulse. So it would be in the 5th intercostal space at the midclavicular line. And then we're going to listen for a full minute. All right, we're at 42 and halfway. All right, and we finished with 85. And really quick, I'm just gonna auscultate the diaphragm for that apical pulse, and that is strong and present. Heart sounds good. All right. So we're gonna go ahead and move to the upper extremities. So we can go ahead and roll your shirt back down. All right, for upper extremities, I'm gonna test your muscle strength first. So if you can hold your arms out like this. Good. I'm gonna pull towards me and you're gonna pull towards yourself, okay? Good. 5 out of 5 on the muscle strength, and now you're gonna hold them up again. And I'm gonna push this way and you're gonna push towards me. Good. All right, 5 out of 5 muscle strength in the arms, equal and strong bilaterally. Okay, now we're gonna do the shoulders. So I'm gonna place my hands on your shoulders and you just shrug up against me, okay? Ready, go. Good. All right, 5 out of 5, equal and strong bilaterally. All right, now we're gonna test her finger strength. So can you go ahead and grasp my fingers as tight as you can? Good. All right, and then can you go ahead and keep your hands like this? And then I'm going to put my fingers out here and you're just gonna spread your hands. Good. Hand strength, 5 out of 5, equal and strong bilaterally. Okay, so we're done with the muscle strength test. So now we're gonna move on to capillary refill. So can I see your fingers? And I'm just gonna press down. Good. All right, capillary refill is less than 3 seconds in both of the hands. All right, now we're going to palpate for your pulses. So I'm gonna take your radial pulse on your thumb side and palpate both of those. All right, good, equal and strong bilaterally, and that would be a 2+ rating. Brachial pulse, good. Okay, 2+ on the brachial pulse, equal and strong bilaterally. Okay, and lastly for your upper body, we're gonna do the range of motion, okay? Okay. So we're gonna start with your hands, or your fingers. Can you unwiggle your fingers for me, please? Okay, perfect. And we're gonna do flexion and extension. So if I can get you to just point your fingers to the ground and then point them back out towards the camera. Good. All right. Now we're gonna test the wrist. So we're gonna do basically the exact same thing, just with your wrist. So just make this and point towards the ground, point out. Good. All right, now we're gonna do the arms, or the elbows. We're gonna do flexion and extension. So if you can just pretend like you're doing a bicep curl. Good. All right, and full range of motion in the fingers and wrists, no limitations noted. And the arms, full range of motion, no limitations noted. And let's move on to the shoulders. So if you will for me, just put your arms as high as they can. Good, and behind your back. Good, and if you can just do them out to the side, bring them up over your head, and bring them out beside your body. Okay, flexion and extension, and abduction, adduction are full range of motion, no limitations noted. All right, and now if I can get you to lay on the bed, if that's okay, if that's comfortable for you. All right, thank you. All right, we're going to inspect the abdomen. So what we're gonna do is, can I pull up your shirt? Mm-hmm. Okay, pull up your shirt, and we're gonna inspect the abdomen for any characteristics. So she has a couple stretch marks on her lower abdomen. No discoloration, no distinguishing markings or anything like that. All right, umbilicus is inverted and matches the skin tone of our patient. Next, we are going to shine this pen light over her abdomen and observe for any pulsations. So there is a little bit of a pulsation of the aorta. All right, and we're going to look at the contours. So contour of her abdomen is rounded and it is symmetrical. All right, so we're done with the inspection part. So let me go ahead and listen to her vowel sounds, starting in the right lower quadrant. All right, moving up to the right upper quadrant, right lower quadrant, or normal active vowel sounds. All right, moving over to the left lower or left upper quadrant. Normal active vowel sounds in left and right upper quadrants. Okay, right or left lower. All right, left lower vowel sounds are also normal active. All right, and now I'm going to start with palpation, okay? So I'm going to do it the same way that we just did listening, but I'm just going to push down just a little bit, okay? Let me know if you feel any tenderness.
Okay.
Any tenderness? Okay, no tenderness noted on light palpation of all 4 quadrants. So now we're going to do deep palpation. Is that okay? I'm just going to press down a little bit more. Let me know if you feel any tenderness. Any tenderness?
No.
Okay, no tenderness noted on deep palpation. Okay, so next I would palpate for your inguinal pulse. Would you like to do that today?
No.
Okay, so patient defers inguinal pulse, but in order to do that, we would palpate between the upper thigh and the groin to palpate for a pulse bilaterally on both sides. Okay. Lastly, we're going to move down to the lower extremities, so you can go ahead and pull your shirt down if you want to. All right. Can you move up just a little bit in the bed? Perfect. All right. So, on starting with the legs, we're going to start with inspection. So, inspecting skin characteristics, we do not, there's a small scar on her upper left knee. All right, can I get you to lift up your legs really quick? All right. No varicose veins present. Temperature slightly cool to the touch. Palpating for edemas, 0. Edemas are not present. Hair distribution, patient shaves legs, so no hair is present. All right. And now we're going to test for capillary refill, okay? So I'm going to go down to her toes and bilaterally look at her capillary refill on her toes. So capillary refill on toes is less than 3 seconds. I'm going to inspect in between each of her toes. Normal color, no lesions, no scars. Okay, good. And I'm going to inspect the bottom of the feet. So no scars on the bottom of the feet, no lesions, no discoloration. All right. Now we're going to start testing your range of motion, okay? So for range of motion of your legs, I'm going to start with your hips, okay? So with your right and left leg, can you raise them up to about a 45-degree angle? Good. All right, left leg. Good. All right, full range of motion on flexion and extension. And can I get you to push them away on both sides and bring them back in? Push them away, bring them back in. All right, good. Full range of motion, no limitations noted in the hip on flexion and extension and abduction and adduction. All right, can I get you to knee to chest on your right and left? Good. All right, no limitations noted in the knees, full range of motion. All right, now on your feet, can you press down like a gas pedal? Good. All right, and can I get you to pull back up? Good. All right, full range of motion in the ankles. No limitations noted. All right. All right, we're gonna do muscle strength really quick. Or can I get you to look at my toes for me again really quick? I wasn't sure if I did that. Can you look on them? Good. All right. Can you go ahead and sit at the bedside? All right, next we're gonna test muscle strength. So I'm gonna put my hands behind your knees and you're gonna pull towards the bed and I'm gonna pull away, okay?
All right.
Good. All right. 5 out of 5 on muscle strength, equal bilaterally. All right. Now we're gonna do the exact opposite. I'm gonna push towards you. Good. All right. 5 out of 5 on muscle strength and the legs. All right. Now for feet, can you push down on my hands? Good. All right. And can you pull back? Good. All right. 5 out of 5 on muscle strength of the feet, equal and strong bilaterally. Okay, can you get you to lay down one more time for me? I'm sorry. I forgot to test range of motion of your ankles. Without resistance, can you just point your feet towards me? Good. And can you point them towards you? All right, perfect. Full range of motion of the feet, no limitations noted. All right, and we're gonna do pulses. So can I get you to bend your knees slightly? We're gonna listen for the Papatio pulses. Good. All right, 2+, equal and strong bilaterally. Okay, can you put your knees up just a little bit?
Up.
Yeah, I'm just gonna feel for your dorsalis pedis pulse really quick. Good. 2+, equal and strong bilaterally. And then we're gonna feel for the posterior tibial. Good. 2+, equal and strong bilaterally on the posterior tibius and dorsalis pedis. All right. And lastly, we're gonna check your range of motion of the spine. So can I go ahead and get you to stand up for me? And you can just stand right here in front of the camera. All right, can you bend forward? Try to touch your toes. Good. All right, can I get you to lean back as far as you can? Good. And can I get you to lean to your left side or your right side? And the other opposite side. Okay, good. Full range of motion of spine, no limitations noted. All right, can I get you to move up just a little bit, please? And can I get you to bend over and touch your toes? All right. So you're gonna pull the patient's shirt up really quick. Palpating down the spine. And her scoliosis test is negative. And no humps or anything on the shoulder blades, equal bilaterally. No distinguishing characteristics there. All right, and can I get you to stand right here? And then can you just walk towards me? Good. All right. Patient demonstrates a stable and equal gait. All right, and you can take a seat. All right, and that concludes our physical assessment. Thank you for letting me do that on you today.
Thank you.
All right.